should I go and do my clinicals? If you are a student nurse, you can do your clinicals everywhere. You can do your clinicals in any hospital. But if you are a first year student, precious one, you are welcome back on GH Health. If you are new on this channel, I'm Derek Ofimabaso, a registered general nurse. And on this channel, we talk mostly about nursing topics. So if you want to join this family, if you want to become a member of this family, kindly hit the subscribe button and leave a comment saying, I subscribe. And we will try as much as possible to reply all your comments personally on this video. Today we are going to talk about clinicals. I'm going to give you anything that you need to know about vacation clinicals. If you are a student nurse, you will surely go for clinicals. If you are going for 4 years, 3 years, or 2 years, you will go for clinicals throughout before you complete your nursing journey. So what is clinicals? When we talk of clinicals, it means that you are going to apply what you learned in school at the field. You are going to apply the theory at the field. In school, you will learn a lot of things. So because nursing is about practicals, about skills, you have to go to the hospital or any health facility every vacation so that you'll be a competent nurse or a midwife. When the time is due for you to go for clinicals, your course rep will take your details, your name, the hospital you want to go for your clinicals. Your course rep will take all those details. When you are about to go on vacation, your course rep will take all those details to your course tutor or the head of department, and they will generate a letter for you. So they will share the letter for you to submit it to wherever you want to go for your clinicals. And let me make something clear. You can do your clinicals in any hospital, any health facility, either CHIP compound, hospitals, polyclinic, anywhere. You can do your clinicals anywhere. So when the time is due for you to go on vacation, you will submit those letters to wherever you want to go for your clinicals. In the letter, all the things that you have covered, the subjects that you have covered, will be stated in the letter. So when the hospital take the letter, they will base on what you have learned in school to teach you. So that is it. That's clinicals. And yema na wasuya no school mo no. And yema na wasuya no school mo ni nyina no. And no, and akwa practice in the hospital. Said ye beya obey competent to remfi. During your clinical section, if you are a midwife, you are not going to stay at the maternity only. You will circulate at the hospital during your clinicals. You will go everywhere. You will work at the OPD, you work at the maternity, you work at the theater. Anywhere that a nurse or a midwife is supposed to work, you work there. Intino, we are midwife, and yes, we are midwife. Akwaji won't you clinicals, na maternity Hong Kong. No. During your clinicals, that means if you are a student nurse, you will circulate everywhere. Copy say 2 years, 3 years, and answer 4 years. No. And within that period, no, say hunu ekwanya ye faso ye adwuma ewo bebia na chese oba na se ye do koto theater hunu say ye adwuma ho ye do koto OPD hunu say ye adwuma ho. Is it compulsory to go for clinicals? Sure, it is compulsory to go for clinicals. If you are a nurse or midwife, na say won call clinicals unhunu hwe. I remember first year you share baby about blood transfusion. That was basic nursing. In basic nursing, you share baby about blood transfusion. It me call clinicals no. Me kai females wo no be blood transfusion. And a nurse ba ko ho o ma me procedure ni nyina o assist me ma me procedure ni nyina. Blood sample was taken. Medical laboratory ho omo ye investigations no and omo blood type cra e wo se ye de manipa no time ne so me kokogye bai just say me ye process ni na. I remember very well that after the clinicals you call school and now one of the courses no a buy blood transfusion 10 marks because of say me call clinicals no me who process ninti no ni na wumtrim me tre pass. Finally me ba betre licensure exams na ato 10 marks. The procedure for blood transfusion. Let me talk about shift. If you are a student nurse, you go for all the shifts, morning, afternoon, and night. But most of the hospitals, if you are a first year student, they will not allow you to come for night shift. So if you are in first year, you only go for morning and afternoon. But when you graduate, when you get to second year or third year, then they will allow you to go for night shift. So if you are going for morning shift, you go for 8 o'clock a.m. and you close at 2 o'clock p.m. If you are going for afternoon shift, you go for 2 o'clock p.m. and close at 8 o'clock p.m. If you are going for night shift, you go for 8 o'clock p.m. and you close at 8 o'clock a.m. So night shift is 12 hours. And the day shift, that's morning and afternoon, is 6 hours. So let me give you a few tips. A bit more competent during your clinical section. During your clinical session, you don't have to argue with your mentor. When I talk of your mentor, they are the staffs. They are going to mentor you. They are going to teach you. So if you argue with them, they will never teach you. Okonas one for respect a mama. Nyadi some betro bibia. Unimkrana one chro. So you don't have to argue with them. And next, never miss a chance to take an opportunity. You don't have to miss a chance to take an opportunity. When there is a procedure and the staff want you to do it, go ahead and do it. I remember I went for clinicals at Compulsory Teaching Hospital. Compulsory Teaching Hospital no. Cannula, mostly near medical doctors and a cannula. Yes, cause a cannula. Adia bina yede share ha. Near the infusions and all drugs are firm. Oko Compulsory, most of the nurses near omonye. I no more say medical doctors juma oko Compulsory sa no me kote no ho. Enti me kra na me mo bida na me mo cannula da. E na me call Compulsory. Patient bi na wose ye boni bi ne die mo si. Nti na wose ye boni bi. E na nurse ni ba ko ka sa me mo. Adi me mo bida. Nti obi ehwe me. During that time no so na me seniors me no mo odun kwa. No mo ba be ye omo rotation ho. Samre no so na student ba ko me junior. Ono so ya admit no ho. E na nurse yi ka sa me nkobo cannula me so me nim ye. But me take this opportunity no. E na me je. Me ye man ye kama nti free ho kono. Se basa ye bo cannula. Veni she woni ase kra na metimi dia she ho kama ma. Se veni ketekete se die kra na because of courage na me nya ya me de bo first one into no. My competent when it comes to securing of a cannula. I'm very competent. So if you're a student nurse and opportunity come your way that you should perform a certain procedure, you have to perform that procedure. Untimi nya kra na kokokoye uye mistake on be correct. The next point, you don't have to act like you know it all. Nobody likes a knowing it all. If you know something and you are saying it is very good, but you don't have to act as if you know it more than your superiors. In Truco Hospital, you bisa question yaka, unim bibi yaka, but enya wadwen say unim be business staffs no more. Enya wadwen say most of the student nurse no they act pompous. Yana you free school by ya adwen ye fresh in bibia no men koye saade no ho. So koye saade no ho a When in bibi kura na wanchiro, staff ni bibi kura na wanchiro. Because wo de any book de and I back clinical side. Clinical side no. Obi aye adwuma be 8 years. Enti bibia no a wonim eba procedure bibia no a wonim. Enti wo kwa wo so bra ho ase. You have to respect them for them to teach you anything that you need to know. You don't have to feel shy to ask questions. Now, so we a student nurse, you have to ask a lot of questions. Because we a student nurse, procedure they will teach you and they will explain anything to you. Especially what bana me procedure bia. Ubi some question because me I like talking. So I'll be happy if you ask me questions, I'll be happy to answer them. So what I say, you have to ask questions. They won't ask you be bisa. Most of the nurses no man chiro. Ubu ho beka say few, but most of us yania ye pa disuana de ye be chiro. What you say kra na say bisa. So what you say bisa because ubu ho be mount different idea. Into what you say kra na say bisa. You have to ask a lot of questions. Where should I go and do my clinicals? If you are a student nurse, you can do your clinicals everywhere. You can do your clinicals in any hospital. You can do your clinicals in a public sector or a private sector. In a hospital, in a polyclinic, in a teaching hospital, in a health center. You can do it anywhere. But if you are a student nurse, if you are a first year student nurse, I will not encourage you to do your clinicals in a big hospital like Compulsory. If you are a first year student, I will not encourage that. Because first year student no kwa unkoye procedure kuntan bia. Most of the procedures are vital signs. Vital signs. They will not allow you to do any invasive procedure. Entino who first year o sha na enko hospital kuntan because uko Compulsory kra na ye de soma na bekun koto we bla koji we bla koye se bra errands nko into first year ube sha se akọ hospital nketo ne mu no now the build capacity hospitals nketo akra no at times uko ho ye ma perform some good procedures. So big hospitals as a first year student, so if you're a first year student, I will encourage you to start from the small hospitals. Then you graduate oko second year now usia medicine surgery no. Now what shall see big hospitals name. So you are welcome with all your questions. All your questions are warmly welcome. Yekase koye procedure bi a ye fast na kokoye. I remember me call one hospital near 3 and a koi from one school. Me name now 43 Kevin Dankwe ename. Ye koye no because of see free one school ntino. O man hye ye schedule no the same time. Me ko bia na me nkohia me nam fofo no. But me kwa na me bodjuma correct. And today, and one of my friend by was, hey, nurses, nurse, are there what the kind of nursing course ni be done because oba ya out mbe ye bia fine. Ada why a juma ni be done sana wo nursing school ana. So na me nya juma ni be da but me kwa me observe first year no. Omo ye procedure bia na me observe omo. Procedure bia omo ye bia na me observe omo na me bisa questions. Enti no say next time me call hospital for during another clinical sa ben say ma apply no ho ben so mo say eh akwa we good o enti no okwa clinical sa e ma we competent okwa clinicals na so bisa questions ye procedure bi e kasa koye na so okokoye a ben say build o ma ba be competent nurse. So you are welcome with all your questions. Bye bye.